Safety 365.
Welcome to Safety 365, where our goal is to help you navigate more safely through your daily activities and understand the importance of taking proactive measures to safeguard yourself. Hi, I am your host, Bill Barna. Once again, my career of 33 years in law enforcement, professional security consultant, and former police academy instructor, trying to put some of that expertise together and make a little difference in your day. Today, we'll be addressing the topic of mental health and safety in the workplace. I am happy to be joined by today's guest, Tammy Weaver, the Vice President of Clinical Services for Coleman Health Services. Tammy, thank you for coming in.
You are welcome. I'm happy to be here.
Now, I know you're new in the field of mental health.
Brand new.
Brand new. What do you have, like 35 years now?
Just celebrated my 35th anniversary at Coleman.
Oh, my Lord. Oh,
Yes,
my Lord. I
yes.
tell you what, you don't get employees like that
No.
with that kind of staying power or with that kind of knowledge. And you started out as a caseworker.
I started as a case manager in our Portage office in the late 80s and had my little bachelor degree, went back to school, got my master's degree at Youngstown State. Got my license in counseling and have been very passionate about homelessness and serving people who are most in need.
Wow. That is fantastic. I mean, talk about dedication, because there is such a high burnout rate when it comes to the mental health field. I've seen, having worked for Coleman for a brief period of time
Right.
as an at-risk navigator, I saw how fast and furious everybody works, and the repetitiveness of just keeping people in services to help better themselves. So there's a very high burnout rate for you to make it 35 years. God bless you. I think you've done a fantastic job.
Thank you. I've been very fortunate to be able to wear many hats at Coleman. So, again, focused on people who are experiencing homelessness with a significant mental health disorder. And then I got into management and managed our group homes in Portage County for about 10 years. Did some vocational work, and then we started the services in Trumbull County in the early 2000s, and I've been in management since then and got into senior leadership about 11 years ago.
Wow. That's all I got to say is wow. God bless you. I mean, you've done a lot, and I kind of feel like you're analyzing me for care right
No.
now. I'm just,
Nope.
she knows me on a personal level as well. So,
Yes.
yeah, well, that's a different topic altogether. Pardon me. So, all right, well, what we like to do here on Safety 365, we like to get started with our safety question of the day. So for most of you out there, how prevalent are mental health disorders in the United States? And I know I can hear the Jeopardy theme going right now in my head. But according to NAMI, the National Alliance on Mental Illness, they say as many as 1 in 5 people has a diagnosable mental health issue. Does that sound right?
That sounds exactly right.
Wow. So if you're sitting there in your cubicle at work or riding in your car and you know about 5 or 6 people and you don't know that they have any mental health issues, it may be you. Right.
Yeah. Right.
The problem is knowing and identifying that you have a problem.
And seeking help. So, sure, there might be people out there who are not diagnosed. They may be experiencing symptoms of a mental health disorder. But, if you've lived with it all your life and you've not sought help, it just becomes kind of part of your life. And
That's your norm.
That's your norm. Yeah.
Okay.
And I don't like to use the word suffer, but people do suffer.
Is it more endure?
Sure.
You just endure
sure.
it. I mean, even if you don't consider yourself suffering, you're enduring.
Right.
And you're getting by with it.
Right. And you don't need to. There is help out there.
Okay. Yeah, exactly. I think back of when I first started into law enforcement, we had places when people with mental health issues would be in crisis.
Mm-hmm.
We had places like Woodside Receiving Hospital that we would take them to because it wasn't necessarily criminal.
Right.
Their actions may have been disorderly or disruptive or whatever, but there was a mental underlying cause, and we would take them to like Woodside Receiving Hospital, and even further than that, I would expand on. They had the county homes
Right.
for people who couldn't manage their own day-to-day activities maybe because of mental health issues.
Hmm.
Now I know, like, was it probably mid '80s they deinstitutionalized, they shut these institutions down.
1988.
Wow.
Mhm.
Okay.
Right. So that's when they decreased the number of beds at the state hospitals and they instituted more community based mental health care, but the money didn't really follow that
Right.
chain.
So they did it as a cost savings effort more than a benefit to the individual patients.
Right.
Or,
Right.
yeah, that's
And so now Woodside doesn't even exist.
right. Yeah, that's just that's a new building, or that might even be a vacant lot at this point. I
Yeah.
don't know. I haven't been over that way in a while. Yeah, I think it's sad because we're asking people to take care of themselves that basically couldn't at
Mhm.
that point. We've released them and say, hey, just continue to show up for your appointments, and a lot of them weren't even capable of doing that without some sort of assistance.
Well, and the system, I think, wasn't prepared for the severity of the needs of the people who were previously institutionalized
Right.
and now are seeking community based care. And that has taken a while for that community based care to catch up with those who needed a higher level of care at a point in their lives.
Yeah, which I will say I was happy to serve with Coleman,
Mhm.
because I think what you guys did was great. The at-risk navigator position
Yes.
was basically if somebody didn't show up for one of their appointments, I was I hate to call myself dog the bounty hunter,
Yeah.
but I would make it a point to go out and make contact with them
Hmm.
to say, hey, you missed an appointment, and it may have just been a mental lapse. Hey, I forgot.
Right.
But we wanted to keep them in services to keep them functioning at a higher level.
Right.
So, I definitely, commend Coleman for doing that. That was fantastic. So, all right. Well, Tammy, I'm gonna throw you a little curveball here, and we're gonna jump right into deep water, and I'm gonna watch your eyebrows go up over your forehead. Uh,
No, Bill, don't do that.
so, let's just hypothetically, a person takes an assault rifle into a theater, a restaurant, or a school, or their workplace, and it just begins opening fire, shooting people. They have to be mentally ill, right? I mean, a sane person would never do such a thing.
I disagree.
Right, and that was very rhetorical.
Yes. So, yeah.
So in general, if we can, I mean, in this line of thinking, and I think a lot of the public thinks this way.
Right.
If you're doing something so violent that you must be ill, you must have something mentally wrong. I mean, if we can conclude that after a mass shooting, the shooter was mentally disturbed, then perhaps we can console ourselves with the thought that there's a rational explanation for why it happened. But realistically, that's our make ourselves feel good theory, so we can stay nice and warm and cuddly in our society. But what I've found out doing a little bit of research on my own, that Columbia University's Department of Psychiatry in New York did a study, and they found it was a study of 14,785 murders between 1900 and 2019, which is a lot.
Mhm.
It's a large time frame. They found that mass shooters in the United States were more likely to have legal histories, use recreational drugs, abuse alcohol, and have histories of non-psychotic, psychiatric, or neurologic symptoms. They said out of the 1,315 mass murders that were examined, only 11% of them had serious mental health issues.
Mm-hmm.
So let's just dispel the theory that when somebody does something violent, they have a mental health issue.
I would like to dispel that theory for
Right.
sure.
Yeah,
Yes.
right. Because I
Yes.
think in general that's the way the public sees it.
Right.
You've got to have a mental health issue if you're going into a theater and shooting people up. Not necessarily the case.
Right.
People get thrown into crisis over a lot of different things. It doesn't mean they have a mental health issue. Sometimes it's just life is piled up on them.
Right, and it doesn't mean they're going to become violent. In fact,
Right.
my premise is that the vast, vast majority of the people we serve are more afraid of us than we should be of them. They have a significant mental health disorder that, they struggle with. And for them to be even with other people is sometimes very
So
difficult.
they become more self-absorbed, like
Well,
or extroverted,
yeah, and
introverted. I apologize.
yeah, and with anxiety disorders significantly increasing,
Sure.
that makes people more shut down and not want to be around others. And so I've only experienced one situation in all my time that I was uncomfortable. So, and I've worked in group homes, I've worked in 24-hour settings, I've been, you know, in people's homes many, many, many times. And in fact, I encourage our case managers to be in people's homes because that's when you really find out how are they really living,
You
what do they
see
really
their
need.
environment.
Yeah.
They're not just telling you something over the phone. You're visualizing this is how they live.
Right.
And there are a lot of indicators there.
Yeah.
Again, being in law enforcement, the powers of observation were everything.
Mm-hmm.
That told a story more than words. So, if mass shooters are not mentally ill, how do we explain the mass shooting or extreme violence within a workplace? I mean, how do we handle it psychologically? We have to find a way to rationalize these tragedies, it seems like. I mean, we had, were they stressed to a point, of a breaking point, which I believe stress is huge, and we're not addressing that in our workplaces or in public. Even locally, we had a guest on, John Everett, who was, pardon me, back in '91, who was a victim of a workplace violence. He was actually shot 3 times,
Wow.
and 2 of his coworkers killed right beside him.
Okay.
And this was a Roderick Davies. He had actually said in court documents that he just flipped out after being fired.
Mm-hmm.
And it took 3 months, but he just flipped out. That was his explanation for why he did these killings.
Mm-hmm.
So I really believe that the stress and it leads to a breaking point. That's kind of where I'm going here. Does it play a role? Stress play a role in mental health? And can it affect safety in the workplace? My personal belief is yes.
Sure.
Because having been in law enforcement, there's stressors, and you could feel it building, and bad things happen. But that brings us into our next segment we like to call "You Don't Know What You Don't Know." That's me on guitar. Okay, so you don't know what you don't know. I like to let that reverberate because, so many of us just stick to what we do know. We don't reach out to try and learn more. So here's what we do know. Mental health concerns typically present in a worker's 20s or 30s. They like the music so much, we're going to play it again. It's my guitar playing.
Yes, it is.
Yeah, I taught Eddie Van Halen. So, no, okay, Lord. So, but since they typically present in a worker's 20s or 30s, not only they just show up, they can last their entire work career. So, other chronic conditions, typically in a workplace, wouldn't appear until 40s, 50s, or 60s. Thinking of people, more physical and ailments and such,
Right.
and that became chronic. Not so much with mental health. Mental health it seems to be rearing its head younger and younger now, and lasting through your workplace. So, with workplace stress increasing rather, it definitely contributes to poor physical and mental health outcomes.
It can.
Obviously, stress can build. I know what stress can do physically. It can wear you down and start deteriorating you. Loss of sleep, obviously. But it seems there's a growing evidence base that shows a connection between workplace stress and the development of depression and anxiety disorders.
Okay.
Does that sound right? Am I off base?
I don't think you're off base. Sure, the workplace can be stressful, but I think as people, we have to be looking out for others. So we talk a lot about self-care, and with our employees, and actually that's one of the questions I typically will ask people in an interview. What do you do for fun? What do you do for self-care? What are some of the other indicators that somebody is under stress? Are they losing weight? Are they disheveled? Are they not eating? Are they distracted? And you want to reach out to those people and find out what's going on so that you're aware and you can see some of the other precursors to maybe that acting out.
Right. I mean, lack of hygiene. Just,
Yes.
they're not how they came in.
Right.
There's things that are changing
Right.
with them. And obviously, I mean, today's society where 1 out of every 2 marriages ends up in divorce, those are stressors, relationship issues. You carry that baggage with you when you go into work. You can have an argument with your spouse, but when you get to work, it doesn't disappear.
Right.
You're still feeling that stress level. So,
Well, yeah, and financial problems, children's problems.
financial problems. What could possibly affect finances in
Yeah.
today's world? I
Right.
mean, this
Yeah,
pandemic,
and
maybe?
yeah, I didn't even want to bring it up, but sure.
You can't
we-
not look at it.
I know.
It's there.
Yes, and we're going to feel the repercussions of that for a long time. I mean, we still have patients who don't want to come out of their homes. I mean, they have really enjoyed the telehealth that we've been able to provide, but we want to see people face to face. And we're really getting back to that, and it's very enjoyable even for the staff. So we're having potluck dinner or potluck lunches next week, and I can't
great.
wait.
What time do those start?
Noon.
Noon. Great. Okay. I don't know
You're
that-
welcome back.
As a visitor.
Yeah,
Only as a
yeah.
visitor.
Yes.
Okay. Well, that's great. That's great. Well, I do believe that the mind drives the activity of the body.
Yes.
You
I
know,
do too.
Your mind says it all. If you have a positive mental outlook and you're clear in your thoughts, your body's going to react accordingly. If you're dwelling on things and the stress just continues to build, I mean, everything else is going to deteriorate.
Mhm.
So we're in agreement there. I look at how mental health, due to high levels of stress, can and does affect worker safety. I look at the ability to make good decisions and recognize potential hazards, or even become a hazard to others because you're not mentally alert or sharp. Like working with machinery or high voltage assembly line work, or even our emergency responders, firemen and police. They face high levels of stress
Right.
almost every day, and compound that with whatever stressors are going on at home.
Mhm.
We talked financial. These guys and women aren't making a bunch of
they're not.
money, and this pandemic has not helped. So add that into the stress level that they're facing with everybody else that's facing that, and they have to make heads or tails of it.
Mhm.
God bless our emergency first responders, because I know I'm a little biased on this, having been one
Yeah.
and retired from the police force, but it takes a special breed, and they handle it well, and I think we need to do a little bit more maybe to help them as well deal with the stress.
Right, and reduce the stigma.
Yes.
So
Right.
we're very fortunate in this area that the Mental Health Board, the Trumbull County Mental Health Board, will provide funding. So if somebody in those services wants to seek out help, we will provide it very confidentially.
Yeah, here's the problem with that, and this is something
Yep.
I've always just had churning in my mind, is we're police officers.
Mhm.
Okay, we go to places, dark places, where other people fear to tread, and we win 100% of the time, because a 50-50 outcome is not good.
Right.
We have to control a situation. We deal with things that most people will never deal with,
Mhm.
will never see, smell, or hear in their lives, but yet it will stay locked in our minds for the rest of our lives.
Mhm.
So we come out of these things. A fireman comes out of a burning building, a police officer comes out of a violent situation, and we're unscathed. We are immortal, all right?
But you're not.
We're not. We do have an Achilles heel.
Yeah.
But I guess, to accept that would be to accept a sign of weakness in the greater scheme for police officers. It's hard for a police officer to say, hey, having a mental health issue, I got to go seek help, because of the fear of his peers looking at him and saying,
Right.
you know what, you're losing it. You're
Mhm.
not as strong as the rest of us. So I would love to see more done. We do mandatory drug testing. Why don't we do some mandatory mental health testing for police officers? Not necessarily testing, So, but a randomized thing where you know what, you could be in a draw and you're put in front of a mental health professional just to talk. And if you don't open up, that's fine. But it opens up an avenue that if you do want to talk and unpack some of this baggage, you can.
Right.
I,
Well, and I think, I get back to the term of self-care. I mean, are we talking about that too? Again, what are you doing for fun? What are you doing in your downtime? Is it productive? Is it healthy?
Well, I
Is
like to
it-
golf at Cranberry Hills.
Yes,
but I'm
I'm-
just going to say, nice little golf course in Champion, Ohio. If
Yeah.
anybody's listening, you want to come out and golf with me, that's where I'll be.
Yes,
So-
it's a great reliever.
It's great. I don't golf well. And if you're a collector of lost golf balls, you'll find a lot of mine. That's all I'm saying.
With his initials on them, his insignia.
Yes. So, we look at all these stressors in our
Mhm.
lives, whether it be workplace and otherwise. And if they're allowed to continue, it's a recipe for disaster, which can place the worker and many others at risk. So, we need to figure out how do we address it. Leads us into our next segment, I like to call reaction time. Yeah. It's my little riff there. All right, Tammy, this is why you're here.
Oh boy.
Okay. So how do we get off this hamster wheel and prevent people from spiraling out of control? I mean, we keep adding stress. Is there any? I mean, obviously we can always say, well, there are medications that help reduce it. But is there anything we can do by ourselves? I mean, I looked at a couple things online. Obviously, I'm WebMD. I can practically be a surgeon now.
Yes.
I mean, what I saw was, and like you're saying, self-help. Find things to relieve your stress. But even while you're at work, one of the things I found was fantastic was deep breathing.
Mm-hmm.
We called it combat breathing when I was in police work. And it was just a way to slow down your heartbeat and slow down everything that's going on. Breathe in for 5 seconds through your nose, hold it for 3 seconds, and then breathe out for 7 seconds. And then repeat that cycle a couple times. And you'll watch your heartbeat drop.
Right.
And you'll watch things kind of melt away. And you're like, okay, I don't feel as anxious.
Mm-hmm.
And that's just one of the things I came up with. Can you give me something else? I mean, is something else we can do,
Well,
self-help wise?
I think we have to just be sensitive and be aware of, as we talked about earlier, any changes that are going on. We at Coleman, I think, are very generous with our paid time off. We've got to give people time off. We've got to support them in their need for time off. We're a very family-oriented business, too. So if your kids have events, we want you to go to those. We want to provide you with a very flexible and autonomous schedule. And, you and I talked about that. We have to trust our employees, too, to take care of themselves.
And there was a great amount of that.
Yeah.
And I spoke earlier prior to our episode here. When I came out of law enforcement, everything was very structured. It was, you put in for this kind of time, you do this about X, Y, Z. To go and work for Coleman was totally different for me. It was, you came in, you logged your hours, when you start time, and you were pretty much free to roam. They trusted you to do what you were supposed to do.
Right.
And if you needed the time off, you took the time off.
Yeah,
So-
and I think we need an appropriate level of supervision that's, again, sensitive to the needs of our employees. Our office in Warren is in downtown, so please go take a walk downtown. Take your 15-minute break. Go.
Great little coffee shop over there called
Yes.
Nova Coffee.
Yes.
I'm going to throw that out there. A little plug in there
Yeah.
for John. Great
Yeah.
coffee over there.
So enjoy the beautiful Courthouse Square and the buildup of downtown Warren again. So we encourage people to do that. We provide company cars, so you don't have to drive your own car for the case managers who are doing a lot of, transportation, going to people's homes,
Yeah.
and
Especially with the price of gas.
yes, that and wear and tear, and
Jeez, oh man.
so
yeah.
just some of those even kind of minor perks, so to speak, that make people feel valued. Like, do you feel empowered and valued in your role, in your job?
So basically understanding that your coworkers have issues in their life that they have to address, and you have to work with them,
Right.
and that makes them feel valued. And as a person, I mean, not just Coleman. This should be
Everywhere.
across
Right.
the gamut here, across the spectrum. So make them feel a valuable part. That they, hey, we do recognize you. We do recognize you as a person. So now you're a little less stressed, thinking, oh, I can't get time off. My boss doesn't let me get time off. So now that's another factor.
Right.
So there's that. We have the deep breathing, something we call mental reframing. It's a term I've never really heard, mental reframing, but basically involves taking an emotion or a stressor and thinking of it in a different way, which I like to say, let's not just make such a big deal out of things. You're on your way to an appointment, you get stuck in traffic. Some people are like overreacting. Oh my gosh, I can't believe this. I'm stuck in traffic. This is horrible, blah, blah, blah. Or you can just look at it a different way. Well, I'm going to be late because of this traffic, but, oh well.
I'm going to make a phone call.
I'm going to make a phone call.
Listen to some music.
Yeah, I'll be a little late. The traffic's bad, but I'll still get where I'm going.
Right.
Yeah, let it go. Water off a duck's back. My dad used to say that. Never understood it till I got older. But more optimism and less pessimism, I think, is good. And the emotional awareness, becoming aware of your emotions. If you live in denial of your emotions, it'll take far longer to take care of them.
Right. And I think living in an air of gratitude, feeling grateful for your life and what you have, and working in this field has made me feel very grateful for.
Well, you're providing such a great service to people.
Well, and that my family's healthy. My parents are still living. I mean, if you think about
You
kind
woke
of
up.
big picture,
You woke up. You're not cold.
issues like that.
You're not hungry.
Right.
And you're not wet from the rain.
Yeah.
You know what? God has blessed you in many different ways.
Yeah.
Let's just take it from step one and go from there. People say, "Hey, I'll see you tomorrow." I say, "You might."
Yeah.
But right now, we'll deal with today and knock wood and
Live in
happy
the
to
present.
be here. Yes.
Yes.
And I think you're right. But I think that comes with age and maturity too. I know you're a ripe age of 21, having worked at Coleman for 35 years. But I do feel that with life experience, you do begin to appreciate these things more. And maybe more people need to get to that sooner. Maybe that's something as an older person I can, my generation can help impart on this younger generation, because they're a very got to have it now kind of generation. And when things don't go right, then the whole world is crushed. But my take on it.
Well, and the level of impulsivity and immediacy has definitely progressed in the last 20, 25 years. So,
and that's
you see that
again, emotional awareness. Why is it that important that you have it right now? Sometimes you have to work for those things, and it takes a little bit longer. It's okay to be angry, but recognize that you're angry and process it instead of acting on it all the time.
Right.
Okay, I can go on and on and on, Tammy. Here we are. But is there anything else you can give us to help people that are in the workplace that are seemingly overstressed? What a good recommendation.
Well, again, another outlet is, does your company have an employee assistance program? So that's where you could
somebody to go to.
Yes, confidentially seek assistance, whether
that neutral party.
Yeah, and it's primarily going to be counseling, but typically you're going to get sessions for free. I know for us, we provide at least 4, and again, not internally. An employee would go to another provider. We also provide it to their family members.
How do you maintain anonymity on that?
Well, you would just get the list of providers and you would pick them yourselves.
Oh, okay. All right. So the corporate.
We have nothing to do with it.
Okay.
No. We would just. So myself as a manager, I would say I would maybe see someone who seems to be struggling and offer. Have you looked into the EAP program? Here's the phone number.
So you can go talk to Dr. Jones, Smith, blah 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 blah.
Right.
Here. And then from there, you don't know anything about it.
Correct, and
that's great.
We don't ask.
That's great, because I think a lot of people do think there's a stigma attached to it, which here nor there, if you're getting the help, who cares?
Right.
But people talk.
Oh yeah.
Everybody wants to point fingers.
Yeah.
Oh, Bill went and saw a psychiatrist, and
Yeah.
You know, he's not as good as we are, or Jane went over here. Yeah.
Mhm.
I get it. I said again, coming from the police world, I get that because that's a whole different sector of society that can't admit there's any weakness or chink in the armor.
Right.
You know, so yeah. All right. So, wow, we're kind of blowing through things here today, Tammy. You're bringing good things to light. Takes us into our next segment called Safety 365 Recap. Another one of my guitar riffs. So our Safety 365 recap is basically just looking back on today's lesson, some of the things we learned in our episode. First and foremost, as many as 1 in 5 people has a diagnosable mental health issue. We have to wrap our heads around that. We have to evaluate ourselves and say, hey, maybe I need to reach out and get some help, to talk to somebody.
Right. And remember, having a mental health disorder is much like having heart disease, diabetes. It's a disease. It's an illness. There is no shame in it.
Right. I mean, you didn't choose to have it.
Correct.
You didn't select it out of a barrel and say, "Oh, this is
take
the one
that
I
one."
get. I'll take that one." Yeah.
No.
No. You. It is what it is. It's how your body's processing things, how your mind's working, and if you need a little help to get through the day, okay.
Please take it.
Seek help. I mean, seek Coleman. I got to tell you, they do great things. They're in a lot of different areas. How many locations do you guys have now?
We are in 13 counties now, so
Okay.
I think we have 23 sites, maybe.
There's no reason not to reach out, and it's very accommodating, very easy to contact them and get scheduled for your first appointment and go to talk to somebody. We looked at the study by Columbia University's Department of Psychiatry in New York City, and that basically revealed that only 11% of murders between 1900 and 2019 were committed by persons with the mental health issues. So let's get away from that stigma that everybody that's out there doing mass shootings and harming others has a mental health issue. Not necessarily the case. Some of these are just violent-driven vengeance or whatever else, but it's not necessarily somebody with a mental health issue. Again, only 11% of those murders. We did identify that stress, STRESS, people, plays a significant role in mental health. And we're all under stress. Whether we see it firsthand and recognize it, we're all under some level of stress. The bills come every month.
Right.
That's stress.
Yep.
Okay. You got to put gas in your car at $4.09 a gallon. That's stressful when you're trying to make a budget run. And when you're trying to get to your Florida home and these doggone airline prices are outrageous, that's a little stressful because I'm needing a little bit of waves and sunshine right now.
Or they cancel your flight.
Or they cancel your flights. Yeah. Yeah, you're stuck in an airport somewhere for 8 hours. But so stress plays a significant role in mental health, and the mind does drive the body. So we've got to address that. 50% of all lifetime mental illness usually begins by the age of 14, and 75% by age 24. So there are some things to think about. Things that you can do to reduce your stress level. Again, we call it the combat tactical breathing, deep breathing exercise. Breathing in for 5 seconds, holding it for 3 seconds, and then exhaling for 7 seconds will reduce your heart rate, will clear your mind. Do that a couple times, and you'll sleep better. Do that before you go to sleep. I am one of those people that does not sleep well because my wheels constantly turn. I practice this. It does help. It slows things down. Obviously, seeking help, seeking assistance from other people. It's probably the best thing you're going to do for yourself.
Right. And help is out there, and until your family or a loved one has experienced a mental health disorder, you're not seeking that assistance. But there is plenty of help out there, and I would strongly encourage people to take the opportunity with the resources that are there.
Tammy, how do they get a hold of Coleman?
We have a walk-in clinic Monday through Friday from 11 to 1:30. So literally you call in or walk in and you will usually, we try to see everybody who comes in and you're seen by a licensed professional that day. It's called a diagnostic assessment intake. And then you leave with scheduled appointments that same day. So the phone number is 330-394-8831 in the
Great.
Warren office.
People, make sure you take a pen and pencil and write that down. It's important to have, and they're easy. You could always Google it and get their information, and even there's some frequently asked questions on their website as well. But definitely take the time to seek the help of professionals like Coleman Services. They can make a difference in your daily living and just how you are relating to others as well. If a pipe breaks, we call the plumber.
Mm-hmm.
Your car breaks down, we call a mechanic. They're the professionals to fix the problem. Coleman's the professionals you need to help with your mental health if you feel you're going down there. So just going to wrap things up here, but I want to give a special thanks first to Tammy Weaver from Coleman Services coming in here. Thank you for taking time out of your day.
Thanks for having me.
Well, always
Appreciate
a pleasure to see you. A special thanks to our show sponsor as well, Bolo Stick LLC, the door barricade device, providing safety and security to homes, schools, churches, and business locations across 42 states in the United States and internationally in 6 countries. You can visit them at www.bolostick.com. And as always, thank you to the Trumbull Career and Technical Center for making this podcast possible. For Safety 365, I'm Bill Barna, reminding you to be aware, be proactive, and stay safe.